Welcome back. Now to a News 12 special report. Imagine having a life-threatening medical condition that may or may not have any symptoms. It is a very real concern. News 12's Chris Jacobs joins us now and introduces us to DVT. Chris.
Tim, doctors commonly call DVT a silent killer. Many people don't know they have it until it's too late. And that was the case in a popular Westchester rapper.
I got nothing but love for you, honey.
Mount Vernon's own Heavy D wowed the crowds at last year's BET Hip Hop Awards show. As it turned out, it was his last nationally televised performance.
A Mount Vernon hip hop legend has died.
Born Dwight Arrington Myers, Heavy D died because of complications from DVT.
DVT stands for deep vein thrombosis, basically a blood clot. The DVT itself isn't the thing that's going to kill you. The concern is that DVT that breaks off and then travels up into the lungs, and that's what can kill you, where it becomes a pulmonary embolism.
Shake me, baby, baby.
Heavy D's pulmonary embolism formed when he developed DVT in his leg on a flight from London to Los Angeles. It usually takes a combination of risk factors.
If he had a long flight, if he had a little trauma to his leg where he banged it, and with the weight, those all could have played enough of a role to create the one killer clot.
David and Melanie Bloom and their 3 daughters were living in Pound Ridge in 2003 when David was an NBC News correspondent covering the war in Iraq.
Yeah, they're already in what they call the attack position.
On April 3rd, David Bloom suddenly died.
Obviously, I was in shock, but I was in more shock because they kept saying a blood clot, and I was like, was there an explosion? You know, was he shot? Like, what? I didn't know what they meant.
David Bloom was a tragic event. He had a long flight to go to do his news reporting, and long plane flights have shown to increase the risk of deep vein thrombosis.
Bloom also had 2 other risk factors. His legs were cramped as he slept in a tank, and he had factor V Leiden, which is a hereditary genetic disorder which causes the blood to overclot.
Shortly after David passed, I really wanted to learn more about it. And I discovered that this condition takes more lives in our country every year than AIDS and breast cancer combined.
So please talk to your doctor about your risk of DVT.
Melanie Bloom is the national spokesperson for the Coalition to Prevent Deep Vein Thrombosis.
If I can save one life for telling David's story, then his death won't be in vain.
DVT has a tendency to hit those with leg injuries or surgeries. Yankee closer Mariano Rivera was stricken after his knee injury. DVT can happen to anyone. It happened to me. I had knee surgery after a basketball injury. A clot formed in my leg and became a pulmonary embolism. My doctor saved my life, but I had no idea how close I came.
You were the lucky one. Most people, once a clot goes to their lungs, they get much more severe symptoms. And what he was trying to portray to you is that a centimeter bigger and a centimeter down the lungs, you're dead. There's no time to go to the emergency room, you're just dead. Even when this occurs in the hospital, to effectively revive somebody, it's hard to do because the clot's blocking it. And if it's a big enough clot, there's nothing you can do.
Unfortunately, Bloom and Heavy D's DVTs were not caught in time. Deep vein thrombosis is treated with blood thinners. The best way to beat it is to prevent it from becoming a pulmonary embolism. Talk to your doctor about possible risk factors. Also, don't ignore any unexplained pain or swelling in the leg. That's the telltale sign of a clot. You can learn more if you go to preventdvt.org. You can also link to their website through news12.com.
Really interesting stuff, Chris. And if there's one thing you want to leave the viewers with about DVT, what would that be?
Well, Tim, it's to keep moving. Basically, if the legs are moving, there's less chance of developing a clot. When the legs are cramped up, like on a long flight in Heavy D's case, or like when my leg was in a cast, the blood doesn't flow well and a clot can happen. There are other factors, but that's the one you can easily keep an eye on yourself.
Interesting stuff, Chris. We really appreciate you sharing that with us, and just so interesting to see how this has happened to so many people, yet, like you said, a silent killer.
Yeah, nobody's heard of it.
Right. All right. Chris Jacobs reporting for us tonight. Chris, thank you. And we encourage you to stay with News 12. We'll have much more on that water main break in Yonkers coming up tonight at 10 o'clock. We'll see you then.